Ashley Ross. Dr. Ross is an assistant professor at Sam Houston State University in the Department of Political Science. She earned her PhD from Texas A&M University. Her expertise is on the administration of hazards and disasters with a specific emphasis on local governments and communities. So last year she published a book titled Local Disaster Resilience, and this book examines 75 counties across the Gulf Coast and was supported by funding from the Department of Homeland Security. She is also a 2015 National Science Foundation Next Generation Hazards and Disasters Researchers Fellow. Today she is going to talk about coordinating for crisis, building resilience, and she's going to give some insights from surveys of Gulf County emergency.
So it's a tight spot to be in between crowd and lunch, but don't you worry, I have lots of practice with this as being a college professor. So I'm going to ask for about 15 minutes and see how much ground we can cover. What I'd like to talk about today with you is what resilience means in terms of coordination, using information I gathered from interviews and surveys of County Gulf Coast emergency managers. We cannot talk about resilience or disaster preparedness, response, and recovery along the Gulf Coast without positioning it in the context of Hurricane Katrina. 10 years ago, the Gulf Coast of the U.S. was hit by the most costly disaster in U.S. history. A Category 3 storm, Katrina, made landfall on August 29, 2005 along the Louisiana-Mississippi border. Approximately 90,000 square miles across the states of Louisiana, Mississippi, and Alabama were affected, and it caused more than $125 billion in damage. An estimated 1,800 lives were lost and more than 1 million people were displaced due to the storm. In the aftermath of the storm's landfall, the nation and the world watched as people all along the Gulf Coast were stranded in their homes, on the roofs of their homes, in hospitals and nursing homes. Conditions and shelters of last resort, particularly in New Orleans Superdome, became deplorable. And for days, the area affected by Katrina was cut off without food, potable water, power, medication, sanitation, and really any form of organizational help. Beyond the tolls of property damage, lives lost, and family structures altered, Katrina triggered a loss of confidence in our federal emergency management system. In the report, Hurricane Katrina, A Nation Still Unprepared, the bipartisan Senate Committee on Homeland Security and Government Affairs concluded that the human suffering following the storm was a result of the failure of government at all levels to plan, prepare for, and respond aggressively to the storm. Multiple factors were identified as the cause of this failure, including unheeded warnings, poor decision-making by government officials, response system breakdown, and a lack of effective leadership. FEMA's 2006 review of state and urban emergency plans echoed the same findings, and academic studies of Katrina and the response to Katrina found similar shortcomings. Congress responded to this by passing the Post-Katrina Emergency Management Reform Act of 2006. This piece of legislation effectively restored the authority that was stripped from FEMA when we had a reorganization following 9/11 with the Department of Homeland Security. So what the act did was reestablish FEMA's mission to lead and support efforts to reduce the loss of life and property and protect the nation from all hazards. In addition to these organizational changes, Hurricane Katrina spurred a fundamental shift in emergency management and shifted this focus from protecting critical infrastructure to building resilient communities. Resilience formally became part of the Department of Homeland Security lexicon in January 2006 with the recommendations of the Homeland Security Advisory Council's Critical Infrastructure Task Force report. Protection, the task force asserted, is a brittle strategy when used alone. Resilience, on the other hand, is dynamic, flexible, and can maintain its function and structure in the face of internal and external change. So while resilience was first applied to infrastructure following Hurricane Katrina, it quickly became touted as a bottom-up strategy for all aspects of emergency management that can empower local solutions to local challenges. The focus on resiliency therefore became an attractive frame, and community resilience has been widely adopted as a guiding principle for emergency management by the federal government and as a result by local communities as well. Despite the appeal of resilience as a strategy, scholars and policy practitioners, like many of you in the room, struggle with identifying what resilience is and how it may be developed, particularly on the local level where it's purported to make the most change. Most conceptualizations of resilience within the hazards and disasters management literature highlight capacities, or the ability to bounce back, the ability of communities to survive external stress and disturbance, or the ability to prevent, withstand, and recover from loss. But these capacities, as we well know, can be and are most likely to be overwhelmed by disaster events, particularly severe disaster events. Resilience, therefore, must be conceptualized and practiced as more than the ability to bounce back or to return to normal. Ultimately, resilience develops where impromptu actions are effectively coordinated to meet the needs of a post-disaster environment. Coordination, therefore, is in theory a cornerstone of building resilient, sustainable response and recovery solutions to the challenges presented by a disaster event. So this leads me to my line of research. I've asked, what are the correlates of effective coordination among local leadership and partners in disaster response and recovery? And to answer this question, I've conducted interviews and in-person surveys in 2011 and 2012 with county emergency managers across the Gulf Coast and the states of Alabama, Florida, Louisiana, Mississippi, and Texas. Counties across this five-state region within 25 miles of the Gulf of Mexico were the target of my survey, and 55 counties actually responded and participated in my interviews, as shown in the dark orange or the dark shading on this map. The analysis I'm about to present to you only includes 52 of those counties due to missing data. What I asked emergency managers to get at this question about effective coordination is, based on past disaster response and recovery experiences, how would you rate coordination and collaboration with the following? Average citizens and citizen groups, private partners, for example, grocery stores and key industries, nonprofit partners, for example, faith-based and volunteer groups, municipal elected officials, county elected officials, neighboring county emergency managers, state emergency management officials, and federal emergency management officials. Possible responses to this included poor, adequate, good, and excellent, and then of course an open-ended response at the end to qualify those answers. The distributions of the responses that I got from those that I interviewed look like this across the groups that I just mentioned. The height of the bars indicates what percentage of all respondents ranked the group in that category as poor, adequate, good, or excellent. And what we can notice is that overall the ratings are positive. What we know in social science research is this might reflect social desirability, or the tendency of respondents to answer questions in a manner that would be reviewed favorably by others. But in the case of county emergency managers, and from what we've heard already today, we also know that this might go beyond social desirability and reflect some political pressures that are very evident in the tensions among the public, elected, and appointed officials. But nonetheless, there is some variance here to note. There are more responses of excellent given in all cases except for citizens and federal emergency management officials. Ratings of coordination with federal emergency management officials on average are the lowest at 2.8, as shown in the bottom table, which is not quite good, while ratings of citizens are an average 3.2, which is slightly above good. In the interviews I conducted, numerous county emergency managers commented that working with federal emergency management officials, namely FEMA, was difficult. As one Florida emergency manager told me, working with FEMA is a pain in the ass, to put it lightly. The problem is poor information and rotation of teams. It creates inconsistency. A Texas County emergency manager was a little more PC about it. He noted that there's a constant game change with FEMA, and it's important to engage federal folks so that you know the rules. This, of course, is challenging for small counties and emergency managers in environments where they don't have the resources to engage FEMA on a routine basis. Regarding citizens, most emergency managers I interviewed interact with citizens most routinely when they're dealing with evacuation and return. And we heard some of that today from Mike and Rick. Evacuations can be highly contentious and political, so many noted that communications with citizens is critical. However, we know that this communication faces multiple transactions. It's not always direct from the emergency management office to citizens. Sometimes it has to go through county officials, local media, in some cases like with Katrina, national media, and then disperse among communities, neighborhoods, and citizen groups like churches and schools in the case where sometimes communication is spotty and you have to rely on word of mouth. When we think about why there's high ratings of neighboring emergency managers on the other hand, they average 3.8, which is a near consensus of excellent among those I interviewed. County elected officials also ranked high at 3.7. Many of the emergency managers in small and mid-sized counties commented on the importance of relationships, both formal mutual aid agreements and informal connections with neighboring emergency managers. They commented that this allows resources, including heavy equipment and emergency responders, to go much further when there's that shared resource pool. The problem, however, is when all the counties are impacted by a severe disaster event. This was the case with Katrina. And when I interviewed folks in Louisiana about it, what they talked about is how since then they've made plans to enter into agreements with counties that are further north. It's similar to what Mike was talking about, bringing troopers from away from the Gulf to assist with Gulf issues. So let's return back to the middle. If you could look at the bottom of that chart, we see mixed ratings of coordination with nonprofit partners, state emergency management officials, private partners, and municipal elected officials. When we think about nonprofits, they're undoubtedly important actors in disaster recovery. For hard-hit areas after Katrina, like St. Bernard Parish, some nonprofit groups stayed for months. But despite their efforts, coordination with nonprofits can be incredibly difficult. Much of what they do is organized within the group and not with county emergency managers. But that organization within the group may also vary. Some groups are actually not well organized, and despite their best intentions, have high turnover in their volunteer workers. This often means, as one Florida emergency manager noted to me, a lot of efforts end up being duplicated. So some emergency managers, including the Florida County EM that I just mentioned, have worked hard to formalize partnerships with nonprofit groups, working with them to understand what they can provide and how best to use their resources in the face of the disaster and make that part of disaster plans. Private partners can also be difficult to work with. As another Florida County emergency manager noted to me, there's no buy-in by businesses in our state in taking part of developing disaster plans because they don't want government interference. Often there's a conflict between the market and government, which some county emergency managers have navigated by routinely bringing in private partners and making disaster plans for response and recovery. We know that this is critical because private partners often control the basic necessities, namely food and water, after a disaster event. So making plans to allow re-entry of key personnel and also doing things like staging generators at grocery stores can go a long way in the first few days of disaster response. Now, regarding state emergency management officials, many Florida emergency managers chimed in, and they complained that state emergency management is unpredictable. For example, we'll send resources without communicating with county-level emergency managers about it. One emergency manager commented that there's a lack of appreciation of local dynamics. From the state's perspective, they're just treating a regional issue, but without sensitivity to local politics. local government's credibility can be diminished, and this can hurt us in terms of collaboration. Another Florida emergency manager noted that state EM is flooded with new graduates with little world experience. She noted, those of us that work in the reality of the discipline of emergency management are being taught to by new college graduates that studied the book for about 2 weeks. We end up educating them, but it is contentious because of egos and authority structures. The point here is that there is some consensus in terms of ratings of coordination, but there also is some variance in different experiences. So to explore this, I analyzed 6 factors that may contribute to higher coordination ratings, and these factors form a foundation of resources that emergency managers may draw upon in coordinating with various groups in disaster response and recovery. This includes the frequency emergency managers reported working on collaboration with public and private partners, the perception of the emergency manager of their position as being one of a coordinating role and not a command and control role, years of experience in the emergency management field, college education, percent of local government spending on emergency services, and the number of staff in the emergency management office. I ran a statistical model, specifically an ordered logit analysis, to assess what relationships might exist between those 6 factors and the ratings of coordination. And the findings, I haven't bored you with the actual coefficients and numbers of it, but what I'm showing you here with the stars are those statistically significant and positive relationships. So I'll just illustrate a few. College education comes up as important and statistically significant when we look at it, these patterns. Predictive probabilities indicate that a college-educated emergency manager has a 44% likelihood of saying coordination with citizens is excellent, while an emergency manager with less than a college degree has a 17% likelihood of saying the same. Emergency managers with the mean years of experience, which is 19 years, have a 48% likelihood of saying coordination with private partners has been excellent in the past, while emergency managers with only 3 years of experience have only a 33% likelihood of saying the same. So we're seeing a decrease with decreased experience. Emergency managers that report on working almost daily on collaboration with public and private partners have a 66% likelihood of saying coordination with local elected officials is excellent, while an emergency manager that only works on collaboration very seldomly, for instance once a year, has a 19% likelihood of saying the same. And then finally, when we look at local government spending, this also matters. Emergency managers in counties that spend the mean percentage on emergency services, which is about 20 to 25%, have a 23% likelihood of saying coordination with federal emergency management has been excellent, while emergency managers in counties with less than 10% spending have a 7% likelihood of saying the same. So what do these findings mean? This analysis indicates that county emergency managers' years of experience and college education, as well as their efforts to work with public and private partners, is correlated with their ratings of coordination with various groups. What is the cause and effect here? This study doesn't necessarily tease that out, but it's clear that experience, education, and consistent interactions with partners are coupled with positive coordination ratings in time of disasters. Perhaps this reflects with what one emergency manager in Florida commented to me and considered critical for building resilience, which is trust. He told me, there must be trust among the agencies acting, and citizens need to trust the information and warnings that they're given. This takes coordination, cooperation, and planning. Moreover, what this study is indicating is that emergency managers in counties that spend more on emergency response have more positive ratings of coordination with municipal elected officials and federal emergency management officials. Perhaps this indicates that less resource-constrained environments can produce better coordination. As one Alabama emergency manager that I interviewed noted, resources matter for resilience. We, meaning the emergency management office, can be more proactive with more funding. And all I think what this points to is giving emergency managers the tools they need to build resilience. For those of us in this room, this applies to us as average citizens. For some of us, we are partners. in terms of being a public or a private partner or an academic partner. And we have to remember that engagement with our emergency management is a two-way street. We also have to come to the table and bring our expertise and our willingness to build resilience on a community level to all disasters, not just hurricanes, but also instances of man-made events like oil spills and slow onset events like droughts and sea level rise. I think at the end of the day, as one Texas emergency manager I interviewed asserted, resilience is indeed about coordination. It's about establishing and maintaining relationships, being constantly engaged in communicating, not command and control. So with that, I appreciate any feedback or questions. Yes.
What kind of college degrees?
All college degrees. College education
All right.
is the way it was.
That's the next survey?
I'm sorry.
The next survey?
Sure, we can change it in the next survey.